Of protective equipment for healthcare workers in Britain has been delayed. The consignment had been due to arrive from Turkey today after the authorities were criticised over shortages in the National Health Service, the NHS. British government officials have denied there's a problem, saying they're trying to ensure the delivery takes place as soon as possible. Nick Triggle reports.
The 84-tonne shipment of personal protective equipment for frontline staff was expected to arrive from Turkey today. Neil Dixon, the chief executive of the NHS Confederation, which represents managers, said there was growing concern about the lack of protective equipment for staff. He said the shipment, when it arrives, would only last a few days, and the NHS needed to have a regular supply of kit for the coming weeks and months. Ministers said China had agreed to supply 25 million gowns, but no time frame for that has been given.
The United Nations Refugee Agency is assessing fire damage at an overcrowded migrant camp in Greece after a night of disturbances. A spokesman said the agency was bringing in tents to replace several huts destroyed by the blaze at the Vial camp on the island of Chios. Russia has registered another sharp rise in new coronavirus cases, more than 6,000, bringing the total to nearly 43,000. There have been at least 300 deaths. Officials say the increase in confirmed cases reflects a rise in testing, with more than 100,000 people being tested each day. The Kremlin says Russia is still in the foothills of the pandemic, not the peak. President Vladimir Putin said the situation was under control.
This year, the Easter festival is taking place with restrictions forced on us. They're necessary to fight the spread of the illness already known throughout the world, the coronavirus. Together, joining forces, we solve problems. And as I've said more than once, we have everything: a healthy, strong economy, scientific potential, and the necessary material and highly professional base in the healthcare field.
You're listening to the World News from the BBC. In other news, one of Brazil's most wanted criminals has been sent home from Mozambique to face justice. Gilberto Aparecido dos Santos was allegedly a leader of one of Brazil's most powerful criminal groups, the PCC. Simon Ponsford reports.
The alleged drug baron, known as Firmino, had been on the run for more than 2 decades. He's accused of controlling international operations for the PCC, overseeing the flow of cocaine around the world. Dos Santos was arrested in Maputo on Monday in a sting operation involving agents from Mozambique, Brazil and the US. A Brazilian Air Force plane with dozens of police on board flew him back in secret to his home country in the early hours of Sunday morning. The PCC, which began as a prison gang, has spread across Brazil. It's now reported to be sending tons of cocaine overseas to Europe and Africa.
The German Foreign Minister Heiko Maas has warned that Germany cannot leave Holocaust denial unchallenged. Mr. Maas released a video message to mark the 75th anniversary this coming week of the liberation of the Sachsenhausen concentration camp. He said it would take 2 weeks to complete a minute's silence for each of the 20,000 victims. Canadian police have arrested a man who's believed to have dressed as one of their officers and shot several people in Nova Scotia. There's been no confirmation of whether anyone was killed in the incident in the rural community of Portapique. The attacker had been on the run for hours. French police have begun an internal inquiry into a motorbike crash that sparked disturbances in a Paris suburb on Saturday. Police said they opened the passenger door of a patrol car to stop a youth riding an unlicensed motorbike without a helmet in Villeneuve-la-Garenne, where more than a third of residents are under 25. That's the latest BBC News.
Hello, I'm Jackie Leonard and you're listening to the newsroom from the BBC World Service. A scathing article appeared in a Sunday paper today in Britain, highly critical of the Prime Minister's handling of the coronavirus pandemic. The report said there was a lack of planning back in mid-February when the pandemic was taking hold, and Boris Johnson wasn't taking the outbreak seriously, opting to miss 5 of the government's top-level emergency planning meetings. A senior British government politician, Michael Gove, has leapt to the Prime Minister's defence and described the Sunday Times article as grotesque. John Calvert was one of the journalists who wrote the report, so why does he believe the government was so slow to react?
It became clear, very much so in kind of late January, early February, that this was going to be quite a serious crisis, and that actually most experts you would speak to about this would say that it's better to overreact rather than underreact. And we didn't really react strongly enough to it, and you can see all the lack of tests, the lack of protection for our NHS workers. The Whitehall machine should have been sent into action at that point, but they didn't. There seems to have been a kind of drift for about 5 weeks, and by the time that the Prime Minister kind of took the helm on it, it was probably too late. The virus was everywhere.
There's been mounting criticism about the lack of testing for the virus in Britain and the lack of protective equipment for doctors, nurses and care workers. Our political reporter is Jonathan Blake.
The criticism, I think, is not some great revelation that the Prime Minister missed these meetings, but the fact that he should have, with the benefit of hindsight, some are saying, been chairing those meetings from the start. And I think that is why we are seeing the focus on the early decisions taken by the government, which some are suggesting now showed a lack of urgency at the time.
Now, Michael Gove, who's a senior government minister, has dismissed this report. Tell us a little bit more about what he had to say.
Well, he has accepted that the government has made mistakes and that the time will come to learn what he described as some profound lessons from this whole experience. But he said that there are several things in the report which are wrong. He went into detail about the Prime Minister's attendance of those meetings, and he described as grotesque the suggestion that Boris Johnson was not paying attention and was not engaged with a response to the pandemic from the start.
And just finally, this scathing report in the Sunday Times talks about a sort of lost 5 weeks, a wasted 5 weeks. What was the scientific advice that the government was getting at the time saying?
Well, it changed over time, and as people have pointed out, the scientific advice has varied throughout. But at the meetings that were being held early on, it was the case that those advising the government seemed broadly to agree on the fact that the response was largely right, and that the guidance for people to wash their hands more often than usual and for longer and more thoroughly than usual was the right way to go. It wasn't until we heard the advice of the government in, I think I'm right in saying early March, that people should avoid going out, socialising and gathering in groups, that things stepped up a gear. But there were those who were warning from a much earlier stage. It's clear to see from this report and elsewhere, and most of it is in the public domain, that the government should have been taking a far more stringent approach from an earlier stage in the response to the pandemic.
That was Jonathan Blake. The authorities in Greece are investigating the cause of a fire at a refugee camp which caused widespread damage and left many people homeless. The fire on the island of Chios followed a night of disturbances and clashes with local police. Our Europe editor is Mike Sanders, and he's following the story for us. First of all, Mike, what do we know about what happened in the camp on Saturday night?
Well, there were clearly disturbances by people very angered by the death of a 47-year-old Iraqi woman. Now, she'd been taken to hospital on Thursday with a fever, and it was suspected that she might have coronavirus, which would be a first on the camps in the island. In fact, none of the refugee camps in Greece at the moment have had a confirmed case of coronavirus. She had a test and it proved negative, and she was brought back into the camp, but either because of the fever or perhaps even possibly because of the panic caused by the idea that she had coronavirus, she died, and she was found dead in her container. And this sparked, unrest from people who thought that the authorities really had neglected her and hadn't looked after her as they should, and there was a rampage. People set fire to the canteen and other buildings, and an administrative building and some tents, and police in fact fired tear gas to try and disperse the rioters and arrested 3 people, 2 Afghans and an Iraqi.
Now, the UN Refugee Agency has said that it's providing new tents for the refugees on the island of Chios, but the camp there was already overcrowded, wasn't it? Tell us about the situation there.
Massively overcrowded. It was originally built as a waste reprocessing plant, and when the deal went through between the European Union and Turkey in 2016 to rehouse or to stop migrants flowing into Europe, these camps were set up. It was built to house 1,000, so already it was one of the bigger camps, but it's got 5,000 people in it at the moment. Conditions are pretty hellish. The water supply is in very, very short, and people are living in tents, containers, and the UN Refugee Agency says hundreds of people will probably now be homeless because of the fire last night.
Mike, thank you. That was Mike Sanders. With so many of us confined to our homes around the world, we're generally having much less physical contact with people, and with social distancing likely for months, what might the impact be? Researchers are launching an online survey to try to assess the concept of affective touch. One of those leading the study is Merle Fairhurst, Professor of Psychology at the Bundeswehr University in Munich, Germany.
Either people are getting more touch than they actually want. They're locked down with people they don't necessarily want to be in a lot of contact with, or indeed somebody might be alone and enjoying the solitude and quiet and calm. But there are also obviously other people on the other side of the spectrum, and we think of touch as having something to do with so-called sociability, how much people actually want to be in contact and sociable with others. And so there might indeed be some people who are craving touch. What might happen as a result is we know that the system activates various chemical messengers in the brain and in the body. So what might happen as a result of maybe not getting touch if we need it might be higher levels of stress or general unhappiness. We do think, though, that we're an adapter species, and so we might actually find that people are finding other ways to cope with, lower levels of social interactions. At infancy, there is a difference in the way that males and females respond to touch. It isn't very well known yet or documented how that difference continues through our lifespan. We know that in infants that men seem to be more sensitive to the withdrawal of touch. And this is obviously quite worrying, because we do know that there's also a gender difference in self-grooming behaviors, which might be one of these compensatory behaviors that people might implement if they're getting less touch from others. They might, go and have a massage or rub their hands or things like that. So men's mental health might be more affected in this time of lockdown than that of women, if they're better at compensating with positive and rewarding behaviors like self-grooming.
That was Merle Fairhurst in Munich. This is the BBC in London, and Danielle has the headlines.
A senior British cabinet minister has admitted that Boris Johnson missed 5 top-level emergency meetings on the coronavirus, but denied the Prime Minister didn't take the pandemic seriously. The UN is assessing fire damage at a crowded migrant camp in Greece following unrest fuelled by rumours that a woman had died of COVID-19. And in other news, search and rescue efforts are underway in western Kenya, where heavy rain has caused mudslides and flooding.
And we will have more on that story a little later in the programme. First, though, Russia has everything it needs to combat coronavirus. That's the words of President Putin, despite another sharp increase in confirmed cases. There were just over 6,000 new infections in 24 hours, bringing the total to nearly 43,000. Our correspondent Sarah Rainsford is in Moscow and joins us now. So, Sarah, sharp rise in cases, but President Putin still sounding bullish.
Yes, that's right. I mean, the rise in cases in percentage terms is roughly the same as it has been for the past week or so, which perhaps explains why people here are talking about a stable rise in the number of people getting infected, and perhaps why President Putin was looking pretty relaxed today as he made what was an Easter message, an Easter address, video that he recorded at his official residence, sitting by the fire with Easter painted eggs and an Easter cake beside him, and he told people the nation here, that Russia had everything under control. Plenty of resources, he said, a strong and healthy economy, plenty of scientific potential, and the healthcare system that he says can cope with what is obviously an increasing number of cases. I think interestingly what officials here are insisting is that whilst the numbers are increasing, the number of people infected with coronavirus, they are saying that in many ways this is because there's been an increase in testing here, more than 100,000 people being tested every day, and they're saying that many, a very high percentage of those people that they are detecting are in fact asymptomatic. They don't have symptoms of the virus, so these are not people who are ending up in hospital. And about a week ago when we heard that the hospitals are already coming under strain, now they're saying that the hospitals are okay, there is capacity. For the moment, Russia is coping.
Sarah, thank you. That was Sarah Rainsford in Moscow. Iran is to allow bazaars and shopping malls to reopen on Monday as the country continues to ease its coronavirus lockdown. Some businesses regarded as lower risk in terms of social mixing have already restarted. President Hassan Rouhani told state television that the authorities were also extending leave for prisoners for 1 more month.
Before this, prisoners' leave was supposed to end on the 19th of April. But now, with the same conditions that we had before, those prisoners who pose no danger can have their leave extended until the 20th of May.
Well, Kazra Naji from BBC Persian is here in the newsroom studio. Let's begin, Kazra, with the partial lifting of restrictions on Monday. Some businesses have already been allowed to open. Presumably that is deemed to be going well.
That's right. The figures of number of new cases, the daily deaths, have been coming down, and today, for example, there were 87 deaths in the last 24 hours. Yesterday there were 73. It seems that in the last 6 or 7 days we've had consecutive numbers that showed the curve is coming down. So the Iranian authorities seem to be more confident. President Rouhani certainly is. He's very in a hurry to reopen the economy, reopen shops, as you said, the shops, small businesses, small companies, offices have started work already, and from tomorrow he's ordering bigger places like shopping malls, bazaars to open, although universities, schools and big government offices are still either closed or partially.
Now, the prisoners' leave, which has been extended for a month, who's included in that?
The Iranian authorities are saying that they have released or given leave to about 100,000 prisoners. We're not sure who they are, what kind of prisoners they are. But what is certain is that many of the prisoners of conscience, political prisoners, human rights activists, all those people many of them are still behind bars, although there are some of them who have been released. I know of 1 or 2 journalists who have been released. We know Nazanin Zaghari, who's a dual national Iranian British, who has been given leave for the time being. She's out of prison in Iran, living with her parents. But beyond that, we really don't know. Those people, dual nationals, political prisoners, prisoners of conscience, many of them are still behind bars.
Kazra, thank you. That was Kazra Naji of BBC Persian. The Chinese city of Wuhan, where the first cases of coronavirus were identified, this week raised its official number of COVID-19 deaths by 50%. The officials attribute the latest figure, which added more than 1,000 fatalities, to updated reporting and deaths outside hospitals. The virus has had a huge impact on the country's health system and economy. But has it also changed its politics? Mark Mardell reports.
Cries echo between Wuhan's high-rise flats. The residents in lockdown are shouting a message of encouragement across the spaces. Add oil. It means keep up the fight. How China has waged that fight has exposed strengths and weaknesses of the world's second superpower. It's not just a medical crisis, it's a political one.
We all know who should be blamed. Too many people are infected. I don't know who I can trust.
The virus spread from a Wuhan market selling wild creatures for meat around the time of the Spring Festival. It should have been the happiest time of the year for the man we're calling Mr. Ding. He wanted to tell the BBC his story, but didn't want us to use his name. The 65-year-old mother fell ill, short of breath, tired, coughing.
From the beginning to the end, my sister drove her to hospital, but I carried her on my back.
Sad stories, bad stories, as well as happy endings will happen in any system. But China is not. Xi Jinping came to power 8 years ago. He's gradually increased his own authority, tightened censorship and control.